country, and I'm talking about ICU beds. From 0 isolation beds, we are talking over 7,000 isolation beds across the country. We are talking about health workers who have been out there, and community health workers who have been out there visiting people in their homes and so on. So I don't want to rate myself as an individual, because it is not by no means an individual effort. If you ask me to rate us as a country and what we have done, then I think I'll throw it back to the audience to do that rating.
Okay, let's hear from the counties then. Maybe Governor Kuti would give a rating of the county's response, because we know, as Waziri said, there have been challenges, especially in terms of capacity, human resource capacity, and actual facility and equipment capacity to handle COVID-19 response. So how have the counties fared on 6 months later? Would you say we are better off than where we started?
I've been assured by the doctors that we have got sufficient distance for us to be able to use the mics without a mask.
And we'll sanitize immediately after this.
Yeah, thank you very much. Your Excellency, good afternoon, everybody. I think when you asked that question of how the counties fared, I think the counties are the total picture of the whole country. And as Waziri has said, everybody was totally unprepared. And it is the leadership, and I would like to emphasize that the issue of leadership, where quickly His Excellency sprang into action and formed these layers of committees. We had the summit, and the counties were plugged in to the summit through our chair. So there was even a co-chairing of the summit between the President and the chair of Council of Governors. At the national emergency level, I was there. And there were other several agricultural committees which are chaired by Munya and Tarakanidi, Finance, Ukur, and Wangamati. So the whole layer and the whole approach to fighting this disease was a well-orchestrated action right from the top that involved the counties to the counties themselves, where the county emergency response committees were formed, the sub-county, and there also it is national government, the county governor and the county commissioner, and then the wards, we had the ward administrators and the chiefs, all the way to the village where we had the community health volunteer and Nyumba Kumi working together. That's national government and county government. I think that whole structure, while decisions were made from up, reached all the way to the ground, and the discussions happening at the village reached all the way to the summit through this orchestra that has really been formed, that actually made our attack to this disease very effective. And the public were immediately able to see that leadership and move along immediately. You will see every time at 4 o'clock, the whole nation is glued to the TV. And every day when the governor is having his discussion on COVID, the county is glued to whatever, whether it's radio. And so there was serious awareness creation. There was a coordinated approach. And therefore, what needed to be done at the counties could be done very quickly. And that's why we were able quickly to create the isolation wards, quickly to create ICU beds, quickly train health workers. The health workers, this is the first time we're having such a highly infectious disease in Kenya. We never had Ebola, even like Congo. So immediately they were trained all the way to the community health volunteers, and the whole nation was following and fully aware. It's like it's a football match. We didn't have football, but I think COVID became a focal issue in the whole country at both national and county level. And therefore that resulted in a lot of motivation among the people, among the workers, among the health workers, the necessary steps taken to protect the health workers, especially the idea of manufacturing, because for a while we were left high and dry, because Italy was scrambling for PPEs, America was scrambling for ventilators, everybody was scrambling and every country was on its own. And I think for a while that brought out a spirit, a very special spirit that I would like to urge His Excellency the President and the whole country not to let go of that spirit that we developed out of COVID. That every Kenyan stood up, those who are able to assist their neighbors. I know people who could actually share their own food, and there was a reason spirit of patriotism and nationalism that really awakened us. The other thing is the spirit of having found that we had no ventilators, we had no ICU beds. Then the leadership provided by His Excellency to say, now we start manufacturing, and citizens started, and our Juakalis started springing into action. They made those beds. Some of those isolation beds are made by our local artisans. Face masks. All counties have now capability to make face masks. So today, the health sector, and actually all other sectors, are much better off because of the awakening of this spirit. I want to just leave one message. As I was having lunch today, I had a toothpick, and I brought this toothpick. And I looked at it and I say, bamboo toothpick made in China. And then I came and sat on that. Everybody should look at their table. There are 5 or 6 items. There is sweets made in South Africa, in front of you. There is Dettol made in Bahrain, in front of you. There is sanitizer made in China, in front of you. There's only water and macadamia that is made in Kenya that is in front of you. I think the spirit of Kenya has now awakened to the fact that we need to make our own ventilators, we need to make our own toothpicks, we need to make our own sanitizers. There is no reason why we should have all this made in China, made in Bahrain, made in South Africa here, because we don't have the same made in Kenya in that China, we don't have made in Kenya in that South Africa, we don't have made in Kenya in these other countries. We need to therefore carry the spirit that has awakened. COVID brought its own death, its own wreck to the economy, but it awakened the spirit of Kenyans to be patriotic and to produce face masks, ventilators, PPEs that are of high quality. Therefore, something must come out of here that we should actually, and I'm grateful that this book, the Preferential Procurement Master Roll, and I thank Betty, to have produced 334 items that we can produce. Why should we still use other countries' items when we can produce these 300 and more? And this should be now the baseline, and we only have to go higher. Thank you very much.
Thank you, Governor Kuti. I think we have veered off from the health response, but it's good at least to bring the Kenyan spirit and the spirit of patriotism. So I'll quickly go to Dr. Ivan Jenga, the chairperson of the Kenya Medical Practitioners and Dentists Council, just to ask about quarantine, because your council was really responsible in looking at our quarantine facilities. And at the beginning of the pandemic, we got a good number of cases from quarantine. Why was this? Were we unprepared, or were there any lapses that really caused people to contract the virus from quarantine centers?
Thank you, Mercy. Your Excellency, I think this is a very good time to reflect on our challenges, our mistakes, and the strengths that we've learned moving forward. Mercy, I remember as soon as the airspace was closed, the Medical and Dentist Council, that's a regulator of health, was told to get other teams and other regulators together and set up quarantine centers for all the incoming flights. And the people that, and I think, yes, there were mistakes, Mercy, when you say we went wrong, but I can tell you, I think that's one of the most important steps taken by our leadership that actually stopped us, and we may live to say this is maybe why we don't have the numbers, the enormous numbers that we were expecting. Yes, of having the 300 COVID beds was adhered to, or it was how it came through. I know it wasn't an easy exercise, Governor, but I can rate you. We went and we did in 1 month. I know 80% is like an A in anybody who has ever sat exams. And we found most of the facilities and most of our counties scored 80%. We had a score sheet and scorecard. You scored 80%. So honestly, let's stop beating ourselves and appreciate ourselves. The other group that I would want to appreciate even during quarantine is the public. This pandemic has affected all people, the families. When you took people to quarantine, the families were also affected. Businesses were affected. So all spheres of our life was affected. So we all came together as Kenyans and responded positively. Let's not also lose that moving forward. As we strengthen our health structures, even to move, we are still within COVID. As we move post-COVID, other health services must continue, facilities must improve as we also embrace UHC. And UHC will only be a success if we make sure primary health care at level 2 and level 3, Governor, that we make sure that that is successful. Then moving forward, we'll all be prepared for whatever comes in the future. Thank you.
Thank you, Dr. So to Dr. Ombajo, the all-important question that many Kenyans are asking is that at the beginning of the pandemic, and Waziri was there telling us, we've seen Italy, we've seen other places, people have been hit hard. But when we look at what we see in the country, 93% of our cases are asymptomatic. We don't seem to have been overwhelmed or to have really suffered the bite of COVID as much as other countries. And why is this the case?
Thank you, Mercy, Your Excellency, and good afternoon, everyone. So, as you very rightly say, when this pandemic initially started, I think all of us were very afraid because of what we'd seen world over. We'd seen devastating scenes of hospitals overwhelmed, of people dying, of the large number of infections that are out there. And indeed, the initial modeling that we're doing seemed to indicate that we'd follow an almost similar trajectory in terms of having a very high number of cases and a very high number of mortalities. And this hasn't been the case, not just in Kenya, but in many African countries as well. And there are many sort of theories to try and explain what this. As CS said, maybe God loves us more than everybody else. But that aside, we could look at, is it the interventions that were put in place, or is there something about our population that puts us at lower risk for very adverse outcomes? So if we think about the interventions, at the very first case that we had, there were some interventions put in place. For example, the limiting number of entries into the country. When we look at the countries that had the biggest outbreaks, they had very many people coming in with COVID and setting up multiple outbreaks within those countries, which means controlling became very difficult. So by limiting entry into the country, that was a very big deal. And as Dr. Njenga says, that quarantine and limiting spread at the very onset was very important. The other thing to look at again is other interventions that we must not downplay. We embrace the issues around wearing of masks early. And we have to thank our government because they did listen to scientists and they did listen to doctors, which was very encouraging for us at the front line as well. Then we think about our population. What is it that's different with, let's say, the European population? And one is that we have a fairly young population, with our mean age being just about 20. And you look at countries where the mean age is 45 and above. And from what we've learned from our own population is that the younger people are less likely to get severe, are less likely to die. So for that reason, we've had a much lower outbreak. Okay. I guess the question then is, what do we do going forward, knowing that, one, we may have something that protects us, but still we cannot drop the ball because we cannot afford to have a big spike.
Okay, thank you. I think maybe you explain a bit of that, and some of the interventions may be questionable. I can hear the bell, so I'll quickly go to Bonaziri and read out some names here. Those Dr. Doreen Lugaliki, Peter Kiare, Marian Awor, Abdi Yusuf, Clifford Manyara, Moses Ringera, Dr. Ndambuki Mboloi. These are just 7 of 16 healthcare workers who passed on after they contracted COVID-19. And there had been conversations about compensations for healthcare workers for particularly even medical cover, their life cover. Bonaziri, do you feel any sense of responsibility to these 16 families and the more than 1,000 other healthcare workers who've been infected by the COVID-19 infection? Because you kept saying they are the frontline soldiers, they are our frontline soldiers. What responsibility does government have for these 16 and the 1,000 others who've been infected?
Thank you very much. First and foremost, I think is for us to appreciate and condole the families of the healthcare workers who lost their lives. But in addition to that, is also indeed condole all Kenyans who lost their lives. And every life is as precious as the other one. And the reason why we were so careful with healthcare workers is essentially because these are the people who are protecting us. And if we had epidemic amongst them, then we were going to be left bare. What did we do? We first started by creating a special ward at Kenyatta National Hospital, specifically assigned for healthcare workers only, so that even as the disease evolved, we were not going to have healthcare workers scrambling for bed capacity, scrambling for treatment, amongst other.
Is it the wheels of government, or what's holding all this back?
I think that a lot of what we have said has already happened. A lot of what we intend to do, for example, the issues of insurance and so on, are issues that are ongoing in discussions with the institutions that are responsible for that. We agreed that, for example, the NHIF was going to be able to cover the healthcare workers. We agreed that the county governments could also get cover from NHIF, for that reason. So it's ongoing. Every day we try and improve a little bit more, a little bit more. And if you talk about the lessons that we learned, that's one of the lessons to learn. That's one of the areas where we thought we had not really crafted properly in the past. We had not really crafted properly and in a response within the health community that is responsive or that is in keeping with, at the same size as the disease burden that we were experiencing. And yes, that's a challenge. And the worst thing we can do, in all the challenges that we have had, including the issues transparency, and we discovered that transparency is a currency, for lack of trust and speculation. Therefore, all these things are lessons that we have learned, and we can't bury our heads to the ground like the proverbial ostrich and assume everything is okay. We will continue to face them as we should.
Thank you, Bonaziri. And now my last question to the doctors. Cholera is still here, Ebola is in the neighborhood, climate change is here. Will the country, from what you've seen in very few words, will the country be able to face the next public health emergency that comes its way? Can start with Governor Kuti, then Dr. Njenga, Dr. Eva, then Dr. Ombajo, then we close it there.
I think the lessons we learned is such that we are more prepared, much more prepared, both at the national level and at the county level, and also the fact that we now have a highly trained staff. The training we gave the staff for pandemics, especially highly infectious diseases, has put us in a better place. The investment we have made in the health in terms of infrastructure at the county level has actually improved our capacity very much. So we are much better off, definitely.
Dr. Njenga?
I believe that we will do better, and we will continue to do better. And we are not saying that the pandemic is over. So please, the message out there is that we should not let our guard down. The corona is still with us. What we are doing is continue strengthening our infectious and isolation hospitals, Governor, and make sure that across with the national and the county governments. That collaboration and that friendship that has developed, we must continue, and involving the community. Community engagement is going to be the key, so that everyone knows, every member of of our population knows that the responsibility on how we respond and how we contain any pandemic or any endemic is a responsibility of each individual. But I think we've shown the world that we can do it.
Dr. Lois?
Thank you very much, Mercy. I think, yes, we are better prepared to handle a future epidemic. But having said that, before COVID came, I ran a unit where we had many patients with cholera every day. Since COVID came, we haven't had a single case of cholera. So clearly we are washing our hands more. We are washing our hands more. We are eating at home more, perhaps. But there are certain things that we've learned as a population that we must not lose beyond COVID. The simple hygiene measures have to continue.
Thank you. Thank you very much. We'll wrap up this panel here. Thank you, CS Kagwe, Governor Kuti, Dr. Njenga, and Dr. Mbajo. I'll welcome the next panel, led by my colleague Trevor Mbija. This is the panel on resource mobilization and utilization for COVID-19 fund. But as we exit, there will be a video just running, so please do watch the video, then the next panel is coming in.
We will continue to provide all necessary assistance to groups, communities, social economic sectors that have been hardest hit by the pandemic.
We set up a small committee made up of staff from Interior, Ministry of Health, and State Department of Social Services to go to the field, to go to the slums and isolate the most vulnerable. And we had a very good criteria. People who are orphaned, children who are actually heads of households, people who have terminal illnesses, people basically who have no other way of survival.
Nilikuwa nafanya vibarua za mjengo, kufua vibarua tu ili waweze kukula. Vile sasa COVID-19 ilikuja, ikabidi vibarua zimekatika. Ikabidi sasa nimebaki tu kwa nyumba tu, sasa sina otherwise. Lakini venye serikali ilianza kututumia cash transfer, at least ikanisaidia kuwa akaweza kupata cha kukula.
Watu wa cash transfer kikuja kama saa hizi, wakinunua mkate, wanunua maziwa, tunafaidika.
Safaricom being the platform that does the M-Pesa bit, they have done something very fantastic in this. What they have done is that they have helped us transfer this money at no cost.
Previously, when you are sending maize, beans and all that, you have to pay about 20-30% to logistics. Now, if we send 300 million shillings to Kenyans, it arrives as 300 million shillings to 300,000 people every week.
Kazi yangu ilikuwa ni kushona viatu. Wakati corona ikiingia, kazi yangu ilididimia, capital ikaenda chini, ikawa sasa sina mapato tena. Hii kazi mtaani hakika imeninua, mambo yale yangu yalikuwa yamekwama, ya rent house na chakula ni itaendelea kama normal.
So kazi mtaani is one of the many interventions that national government has put together with respect to the COVID-19 response. The criteria was, first of all, you must demonstrate dire need. Secondly, you must not be benefiting from another social protection program. So like if you're a recipient of the cash transfers, you are not considered for this particular program. And number 3, you don't come from the same household.
Nilikuwa nafanya tu kazi ya saluni, nikaenda pale hivi ma estate kufuafua nguo, wakafunga ati kuna corona. Sasa senye hii kazi nasema imenisaidia nisingekuwa na kazi.
My microphone is on. Thank you. There we are. Thank you so much. Good afternoon, everyone. Kindly just wave. I can see we are all tired, but please, gentlemen, we are happy to be here this afternoon. It's the middle of a pandemic. Thank you so much. I'd like to recognize all your presence. My name is Trevor Umbija. I'll lead this next panel discussion on the COVID-19 resource mobilization and utilization as well. This is where the rubber meets the road. And the president asked a fundamental question. Did we use our money and resources prudently? Okay. And efficiently. Thank you so much. All right. So there are more than 200 people who are joining us on Zoom. They are senators, governors, PSs, civil society. We want to recognize your presence. Mr. President, it's good to see you. Thank you so much. You know, when people meet the president for the first time, they tend to cry. So I came with my handkerchief just in case. But I'm happy to see you. Thank you so much. All right, so I'd like to introduce my panelists real fast, beginning from my immediate right. Dr. Julius Muya, the Principal Secretary, National Treasury and Planning. We have Jane Karuku, who's the Chairperson, Kenya COVID-19 Fund. We also have Honorable Justice Retired Paul Kihara Kariuki, who's the Attorney General. Thank you so much for making time for us. And Sid Chatterjee, Resident Coordinator, United Nations. Thank you so much for coming in. And Governor Wycliffe Oparanya, who's the Chairperson, Council of Governors. Thank you so much for making time this afternoon. In the interest of time, we'll get right into it. PS, you are the accounting officer. The president posed a fundamental question. Did we use our resources prudently and efficiently? Let's start from the point of how much did we actually have when we started the fight against coronavirus?
Well, thank you very much. I'll actually go a step back and answer the question. Did we also raise our finances in an efficient manner? But first, let me say that when the COVID visited us, the situation that we had was one of declining revenues. And then again, we had a lot of pressure because the expenditure pressures were caused by floods which were there in December, the locusts that came end of December, then we had a dry period earlier on. And so as Treasury, we looked at where can we get money quickly and money that is not expensive. I think that is very important. And so we looked at our multilateral partners. And in this case, it was World Bank, whom we were having a program of development policy operations. We looked at FDB, that is Africa Development Bank. We looked at IMF, and they were able to give us fairly low-priced loans in that case. And then we were also able to get funding from Danida as a grant. The total pledge that we were able to mobilize was 134 billion Kenya shillings. Right. Including in that was 130 billion that we received in exchequer.
All right. I think that deserves a round of applause. 134 billion shillings. But PS, did we use those resources prudently?
Now, what then did we do with that money? First, we identified what were the immediate needs as developed by the ministries and the institutions that were at the forefront. And so what we were able to disburse was 82 billion Kenya shillings. Now that 82 billion comprised of two main elements. One main element was 53 billion, which was on account of directly COVID-19 related expenditure. The other component within the 82 billion was 29 billion that we used for budget support because our revenues had declined considerably. And so in terms of using prudently, for us in Treasury, we made sure that we only made money available when there was a convincing case.
All right.
Thank you.
So we still have change of about 52 billion. We'll talk about that in just a bit. The Attorney General, there's been a lot in the public media in the last few weeks about procurement. The President himself gave directive, 21 days so that we get the facts from the fiction, from the investigative agencies. How far are we with that?
Thank you, Trevor. We've made good progress. The investigations commenced on the 18th of June, following the allegations of irregularities in the procurement. And principally, the culprit, so to say, was KEMSA. The action taken with regard to those allegations of some 7.8 billion shillings. Firstly, the EACC approached it in a two-phase mode. That is to say, they looked at public officers who were alleged to have participated in those alleged losses. And the second phase will be to the suppliers, some 78 plus companies locally and elsewhere. As regards the first phase, some 52 persons of interest have been called in to write statements, and they have. And the documentation with regard to the payments has been secured and has been analyzed. And as we speak, a report has been tendered to the Director of Public Prosecutions with regard to those cases involving public officers. And the DPP is currently reviewing that material and will at some stage in the very near future decide on whether or not prosecutions will proceed.
Yeah.
Even as that is going on, the EACC has embarked and is progressing well on the second phase, which entails, as I've just said, the companies that were the suppliers. That is the current state of play.
Yeah. What are some of the lessons you think we should learn from the relationship between the Ministry of Health and KEMSA, for example, so that there's not any backpedaling and also it was me, it wasn't me, she said, who said, nobody said. How can that be made more efficient?
Well, this will be informed more when we have completed the investigations, because there'll be administrative issues, there'll be legal issues that come into play. We will examine the legal framework, and we did this with the other cases that have preceded this, like anyway, it'll come to mind. But as CAP Secretary Mutahi Kagwe observed earlier, our institutions are only as good as the persons who lead them. And as His Excellency has said, and persistently in the war against corruption, he has led from the front by personal example. That is very, very, very critical. And as leaders, whether it is at ministerial level, whether it is units like KEPSA and so on, the leadership must be above board. And we assume in a time when we are caught up in a situation like we have, that we're good. Of course we're good. Yeah. But we forget one fundamental. There are people out there working night and day to take advantage of these pandemics, these very circumstances, to make money. If you don't believe me, go read the 1948 novel by Albert Camus, who's a French author, who detailed the effects of a bubonic plague and the effects that has on men. Okay. There was an old pharmacist there who was medicines and selling it at sky-high profit.
From one county to the other. I think the lowest county per million and the highest county provided 400 million. This is the figures that we got at the Secretariat. But at the national level, because when the disease started spreading, of course, through His Excellency, he organized extraordinary summit where we met, and we requested as county government that we needed support. In the process, we were given 5 billion from the national government through the order of His Excellency, the President. Now, it reached a time when we thought that we could motivate frontline health workers. And when other counties were thinking of how much to pay, we engaged SRC. And SRC came up with standardized or uniform payments to the frontline workers. And through the Ministry of Health, we were given 2.36 billion. That is the only money I can say that we received directly from the national government. But however, we did receive 350 million shared equally to all counties from Tanita. 350 that went direct to level 2 and level 3 hospitals or health centers. And then finally, we received a donation of 30 million to specified counties, about 13 counties, from the EU. But this money, unfortunately, never went direct to the counties. The EU used independent agents to carry out activities in the few selected counties. And that's the money that we received. For the 5 billion we received, a special audit is being carried out by the Treasury, by our internal audit, National Internal Audit Office. For the last 2 weeks, they have been in the counties, and we are yet to receive a report.
Yeah, but from where you stand, would you confidently face Kenyans and tell them there was value for money? Their money was used prudently at the counties.
I can tell you that this money was prudently used. But as I speak now, not all of this money has been spent because of the bureaucracy of moving from one financial year to the other financial year. Because there were supplementary budgets to be undertaken because it was towards the end of the year. And also there was a shortage of some goods on the market. So some of those goods had to be imported from overseas. You could not get ventilators, you could not get beds. They had to be imported. Some of them are just arriving now. But there was proper commitment because the county response committee had to come up with work plans and commitments. So this money was actually committed, although it has not been exhausted.
Okay. So there's still some change as well.
There is still some change.
Change here.
Yes.
So let's bring in Jane Karuku on this. Yours is a different story. Yours is what the president called unprecedented unity of purpose. How much did the ordinary Kenyans and the partners, everybody else, how much did they raise towards the COVID-19 fund, and how was it used?
Thank you, Trevor. I'll try and answer all your questions at once so you don't come back to me. I've learned what you're asking. So I think when we were created by Your Excellency, I think he was very gracious. He gave me a great team. And I can tell you, you can imagine how our board meetings went between James Mwangi, Michael Joseph and others, and Joshua. But it was a lot of fun. And we were also lucky to get C.S. Matiang'i and a very good secretary in Kennedy Kihara. And Governor Oparanya was also part of that. So what we did immediately is that we knew our objective was to raise funds from the private sector and others. We formed an entity to protect ourselves, so we are a company limited by a guarantee with a board of directors. That's what we know how to do best. We formed committees, and we were laser focused in terms of what we were going to do. So we only chose 2 things. supporting the health sector, and supporting our communities in livelihoods. We brought on PwC, Deloitte, and KPMG, and Ernst & Young to make sure that we can fully account, and Trevor can answer you 2 years from now whether our money was well used. So we did it up front. We also brought experts to support us with health. So the health committee, which was led by Dr. James Mwangi, we adopted Professor Masharia, the great ENT specialist, and a group of medical doctors, Union, KPMDU, Nursing Council, and clinical officers, etc., because we didn't know what was going on. This was staff. We then made a few principles as a board. We said, whatever happens, we are going to pay a premium for buying local. So we said any money raised in Kenya is going to be spent in Kenya so we can sustain and build Kenya jobs. We then said that anybody who's going to help us with this work is going to do it for free. Trevor, we didn't even take a cup of tea.
Oh, wow. That deserves a round of applause. But how much did you raise?
So we raised, we had in kind and in cash. In cash, we raised just over 2.6 billion shillings. We coordinated food worth about 450 million. We received food, which the KDF were with Kiambu County. We are refurbishing Tigoni Hospital, Buy Kenya, Build Kenya principle. Yeah. We then bought, so for the PPEs, we've promised the country that in the 65 hospitals, for 18 months, we are going to provide PPE. If we don't need, we can divert our money. But that's a promise we made. Yeah. We then decided to give masks to our communities in Nairobi. We bought 2.6 million masks at the price of 100 million shillings, and we distributed, supported very well by Ngao and county commanders and other people, partners that we were working with. The other thing we've done is with psychosocial support, worth about 95 million. I know you want to stop me, but I'm answering all your questions, Trevor. And then the last thing is what was really, really pleasing to all of us was the money we gave to the needy communities, about 100,000 people in Kenya, and in Nairobi and the environs. We gave 1,000 shillings per week for a month, worth about 400 million shillings. Safaricom gave us a moratorium from Fuliza.
Yeah, I was about to ask you about Fuliza right now.
To tell our people to remove the money. They had a moratorium of 48 hours. Okay. Otherwise, it was going to be swallowed or measured by Fuliza. So thank you, Peter. So that was good. So what have I not answered you? So have we used our money well? We think so. Yeah. Because we think we have transformed the local industry. And I think when we give back to Kenya, it's that we can do.
And CS Eugene Mwamba, by March of 2020, we sat down together at the United Nations family, repurposed $45 million or 4.5 billion Kenya shillings from our existing UN Development Assistance Framework to respond to this public health crisis. An additional appeal was put out on the 9th of April, again together with CS Yatani and Eugene Wamalwa, and approximately $58 million was raised, or about 5.8 billion Kenya shillings. In the meantime, in consultation between President Kenyatta and the UN Secretary General, an additional $10 million was brought in, or 1 billion shillings, for the construction of a hospital, which should be ready in the next 2 weeks with Nairobi Hospital, not only to respond to COVID, but something to leave behind as a post-COVID care facility for a 100-bed hospital. On all counts, let me just state this categorically, that we don't have any issues with all the investments we've made so far.
That is a good point, because what Jiku has always been concerned was the money stolen.
I also want to, but then, the UN is a member states organization. It's not isolating, it's not on its own. And frankly, we would not have been able to do this had this not been for the absolute and unconditional support of the European Union, the United States, China, the United Kingdoms, Russia, France, Japan, the Nordics, India, Ireland, Germany, Netherlands. I mean, absolutely spectacular. And I really want to single out China for a moment, because the speed with which they were able to send PPEs and supplies, not just to Kenya, but across the 54 countries in Africa, was meritorious on all counts. So it needs to be said as it is. Yeah. With the European Union, for example, we are working very closely with CS Joe Macheru's office in order to digitize procurement, digitize land legislation. So I think it will be technology and innovation that will help us to overcome some of the perceived challenges. Yeah. But on all counts, as the resident coordinator to Kenya, as the UN's resident coordinator to Kenya, I'm very proud to serve in a country which has not just dealt with a triple crisis, but done so with great aplomb.
All right. Thank you so much. And I'll give you each 30 seconds to respond to this question because we only have about 10 minutes. I know time flies. I'll start with Dr. Muya on this. What are the lessons that we've learned going forward? And do you think we responded to the pandemic in the right way, sufficiently, like the President asked? Were we sufficient in our response to the pandemic?
Yeah, thank you. The lessons learned. First, it is the fact that we can deal with a challenge which is not normal. And that ties with what Sid has just said, because we had multiple challenges which were rolling and coming one after another one. And so, from also a resource mobilization point of view, it proved to us that we can raise resources using our networks and raise resources that are as cheap as possible. And also the fact that we can mobilize resources very quickly. But if I can also tie this answer to a question that you have asked, I want also to say we were able, against a lot of demands of resources, to very easily think about how to ration the money that we had, how to allocate, and how to prioritize. And that was using the frameworks of our public finance management mechanism, where we have got a very clear framework there. You've got to follow a budgeting process. And so that was a very, very important learning lesson. But then also on the expenditure side, we also learned that we can live with a lot less than we normally live with. Because we were able to curtail on a lot of expenditure. Yeah. And we went through the financial year well. And as you said, there's still some change, yes, which is remaining on the COVID money, about 40 billion.
Okay. I'm not sure whether that's a good thing coming from the Treasury. If we can live with less than what we have, it means we should all brace ourselves for tougher times. Madam Karuku, I'd like to come to you on our change also. And what do you intend to do with the rest of the money? And what are the lessons that you've learned so far?
Yeah, so let me start with the lessons. I think the lessons is how we quickly came together, private sector, individual citizens, and government. And we tried to approach this pandemic from a resource perspective. We had people giving us 100 shillings via the M-Pesa, and we had Dr. James Mwangi giving us a very significant contribution of 300 million shillings. We also had some development partners chip in a bit. The more important was a spirit of giving. So we got very many calls in our secretariat about how can I, as a church group, as a family, as youth, go and donate somewhere else. We had overwhelming requests. I want to contribute my time to your board, to your activities. What can I do? Yeah. So there's a real good thing that Kenyans have from a spirit, and I think we should never forget that. The change, I don't think things are over. We don't know. I guess we don't know, unless today we are being told there is no more COVID. So the change is to help on any other urgent issue that we may need. Yeah. We still have some people who want to give us money, I think. So I think we continue to fight on.
Okay. Yeah. Attorney General, 30 seconds on the lessons we've learned and the sustainability ways going forward.
Thank you. As I said earlier, we're going to be looking at policies and procedures at KEMSA and the relationship between them and the ministry. And the example I was citing earlier, which escaped my mind, was the National Youth Service, where there were similar problems. And arising from that, there was a review report which was prepared, very extensive document, and handed over to the ministry concerned. and they're benefiting from that immensely. But there is one very important aspect that I must emphasize, and that is this. People will be prosecuted arising from what has happened at Kemsa. We as a people must learn. His Excellency earlier spoke about that unprecedented unity of purpose. Add to that effort. Add to that the most significant of them, purpose. It's got to be in our minds as Kenyans. It's got to be in our hearts as Kenyans. Who does this? It is we leaders, we who are charged. Whether in the private sector, like my sister to my left, or whether in the public domain. And what happens when these people come to court? We start talking about our tribe, our people being finished. I hope to God we can desist from that and allow the law to take its course to its logical conclusion. You talk about buy Kenya, build Kenya.
Yes.
Why don't we act Kenyan for Kenyans? Act as AG for Kenyans, as a Kenyan. And if we do that across the divide with my good friend, the governor here as chair, the three arms of government are here represented with patriotism, then we have a chance to give a truly purposeful legacy to our children who will come after us.
All right.
Thank you.
Thank you for that. Sid, 30 seconds.
Well,
go ahead.
The pandemic has reminded us the primacy of universal health coverage. I commend you, President Kenyatta, for having made that as an important part of your legacy. And as far as the world is concerned, it has become abundantly clear. You know, it was a Greek philosopher called Herophilus who said, without health, we have nothing. And the pandemic has just proved that to us. It's not about if there's going to be a next pandemic, it's about when it's going to happen. And I think our preparedness in getting universal health coverage right is the pathway forward.
Okay. Thank you. Governor, very briefly.
When we
raise your microphone just a bit.
Yeah.
Thank you.
I think when we received the 5 billion, there was quite hesitant by some county governments spend the money. Because as you know, EACC is hanging on everybody's head. So people were very hesitant. So in the future, I think what is required is proper guidelines. When such a money is released to counties, there must be proper guidelines. Secondly, in institutions like the county assemblies, you know, they don't know how to deal with emergencies. They keep on playing their own politics. And it took time for some of the counties actually to pass their supplementaries. And institutions like control of budget should know how to respond when we have emergencies. Lastly, we must also have, I don't know if there is a national policy on dealing with the infectious diseases.
Okay.
If it is there, then the capacity, the counties have the capacity have not been built at the county level, so that they understand that when such a thing happens, how do we deal it?
All right.
Lastly, our working together as county government and national government, it has helped to contain this disease.
All right. Thank you so much. A round of applause for my panelists as they walk out. That is the end of it. Thank you so, so much. Just kindly leave your microphones there. They'll be sanitized. And now I'd like to call, you can walk out to the right. Thank you so much. I'd like to call upon my colleague Joy Doreen Bira from DW to moderate the next session. It's about building back better lives and livelihoods. But first, I'd like to draw your attention to the screen over there. We're going to run a short video for you just to see what we mean when we say we are growing back better and stronger. My name is Trevor Mbija. Thank you so much for listening.
is primarily a disease that affects the respiratory system, and therefore we've had to deal with it as a health challenge and to ensure that we minimize the spread of the virus. The Kenyan business community has spent time and taken and really risen up to the task to produce necessary medical commodities that used to be imported. Personal protective equipment, masks, and ventilators, and all these products have been previously imported. But I'm actually quite glad to note that in the space of 2 weeks, the Kenyan business community had adjusted themselves to be able to supply these goods. And currently, we enjoy goods that are made in Kenya.
And as we stand, indeed, we are now exporting PPEs and face masks. We are very, very far towards developing the ventilators. And as we speak today, the one by Kenyatta University has already been certified by Kenya Bureau of Standards.
The other important thing that has come out during COVID is the issue of technology and the fact that the fourth industrial revolution is here with us. So issues around the Internet of Things, 3D printing, incorporation of technology into the manufacturing sector and also into our supply chains. We have seen e-commerce take a front line during this period.
And as we start opening our businesses, opening our schools, opening our places of worship, this is a young man who has responded to it by coming and developing thermal guns, which are all locally manufactured.
Good evening or good afternoon to each and every one of us. My name is Joy Doreen Bira, and I'm a business journalist here in Kenya. Because we've been sitting for quite some time, and I know that many of us came in here driven, and we only took the stairs up, I would like to request that we stand up for just a few seconds to stretch out a bit. Yes, and I was told that half of us here fall in the category where we need to keep active. So I would like for us to stretch out our hands to the front, yeah, and to the back. Yeah, now we can have a sit. I'm sure that's just good enough. All right, ladies and gentlemen, my panel basically focuses on the future, what we can do going forward, how we can build back better, and use some of the lessons that we have learned during this period to even do better. Because as we all know, since the pandemic hit, it wasn't just Kenya, but the entire global economy was kind of a damsel in distress. So we want to look at some of the lessons we've picked out and what we can do going forward. And my first question is going to be the fifth question that His Excellency the President asked. Have we built the ability and speed in our system as we de-escalate the COVID measures? Have we built the ability and speed in our system as we de-escalate the COVID measures? And also looking at the current state of the economy, I would like to pose this question to Ambassador Uhuru Raila, who is the Cabinet Secretary for National Treasury and Planning.
Foremost, let me take this opportunity to thank for this opportunity to put a few things right, to share from where we sit in the National Treasury. You are aware that, we've been hit by this shock like no other, no experience, no reference point, any time in history of this country. And therefore, IMF, which is one of the most important financial institutions, predicted doom for the global economy. They predicted a growth of negative 4.9% of GDP for all economies across the globe. That is massive. And through this, and then Kenya, they had predicted both in Kenya and the region that we are going to have a negative growth of 1%. And faced by the circumstance, we had to come in and understand how are we going to deal with it. Of course, trade has been affected, the productive sector has been affected, the financial services have been affected, and therefore also there is the compelling need to continue servicing the country, particularly in expending more on the health sector. And as a result of this, under the direction of our president, we are to come out and identify what are the critical elements that needs to be underscored. One, that there has to be a reason as to why we should contain sustaining liquidity in the economy. We have to push on business, create, if not create, but at least sustain the jobs that are there. And additionally, there are also a significant number of this country, Kenyans, who either lost jobs or lost opportunities, and therefore they needed to be supported. Those were the parameters that we are looking at. And that's how we came with the first line of intervention, by coming up with a combination of both fiscal and monetary measures, by making sure the economy remains liquid. How did we do it? We had to take an equivalent of a pay cut as a government to reduce on the VAT from 16 to 14%. We had to reduce on income tax, both for corporate and individuals. Additionally, we had to forego taxes for any Kenyan who is working, who is earning 24,000 Kenya shilling per month. The net sum of all these, additionally, we also put pressure on governments, both national and the county government, to honor payment of pending bills. We had to carry out a refund of VAT to the tune of 10 billion. Additionally, we also support the vulnerable segment within our society by providing resources to the tune of 10 billion cash. The net sum of addition on the monetary front, the governor of CBK is here. We had to reduce the central bank lending rates from 8.25% to 7.25%. We also had to ask the suspension of listing of loan defaulters in the credit bureau. In addition to a number of other interventions, including even taxes at the lower level.
Right.
And as a result of this, we had to forego Kenya shilling 172 billion in form of lost revenue for the government. But we also did heavy investment, particularly in the areas of the informal settlement, by making new roads, by constructing over 100 boreholes, doing also health facilities. And the net sum of all these is to increase the agile levels of our people, and with a view of also fighting the spread of the pandemic. Now, we came to the second layer. The second layer, because that was a response to the initial shock. But in the medium time, we also came up with a stimulus package, where our motivation is to make sure that we will not only create jobs, but provide livelihood for the people. That's why you see the Kazi Mutani. There works along all these, and the net sum of all these is to substitute mechanization of contracts or, public labor using local labor.
Right.
Making sure that, at the end of the day, we have decent work to do. We can also have money in the pocket and also support the local economy.
So would you say we have built the ability and the speed in our systems to de-escalate?
Very much.
Yeah.
Were it not for those immediate intervention, things will have been different.
All
And
right.
that's why Kenya is different from the rest of the region. And how is it different? All the vital indicators of the economy are actually, we have disproved the prediction that across the globe. We were expected to grow at a negative 1%, but now our growth is at 2.6%, the highest in Africa.
Okay.
And
I'd
this
like
is
to
very
pose-
positive.
Yes.
We have the inflation rate that was predicted actually to go through, the roof. But now we have an inflation rate that's lower than last year around this time, at 4.3, when last year was at 5%.
Okay.
And we are also lucky because God has also given us sufficient rain. We have enough food. And as a result of this, not only the supply of food at a cheaper rate, but also the adverse effect on the manufacturing sector has been mitigated because most of our manufacturing sector is in the agro processing. I think those are things but importantly, We do not want to stop there. We are looking to the future, and we have come up with a recovery process that's going to take us for the number of years, and we are going to look at the micro stability. We are going to look at, resource mobilization, not from loans, but, within, by ensuring that the PPP works as expected. And those are and also entrenching the place of ICT, because we've realized that indeed this can be a turnaround of the economy by investing in that area. So those are things that we are looking at.
All right. I would like to pose the third question that the President asked. Were we sufficiently responsive to the unknown twists of this pandemic? And in looking at it from an industrialization perspective, CS Betty Minor, I would like to pose this question to you. Do you think that we were sufficiently responsive to the unknown twists of this pandemic, looking at it from that perspective? CS Betty Minor, the CS for Industrialization, Trade and Enterprise Development.
Thank you very much. Okay, I think that's the... Thank you very much for that question, and thank you very much, Your Excellency, for putting this conference together. From where I sit, I think we can answer that in a very strong affirmative. There is a Kenyan often saying, I think your car breaks down on the side of the road in a small village, and somebody shows up, those cars that you could fix, and you explain, and they tell you, inawezekana. And it's a guy who just came out from nowhere. But I think that can-do attitude of Kenya is what has saved us during this period. The response, for instance, to production of medical commodities, CS Kagwe just mentioned it at one NERC meeting and said, we're running short of ventilators. Can these people make it? In the presser, immediately after that, we challenged the motor sector to come up with ventilators. In 2 weeks flat, we had a prototype we were reviewing in our office. And right now, we have 2 which have been calibrated and are out for clinical tests. It's been done in less than 6 months. These guys had never done ventilators before, but now it's actually something that could go into the market before the end of the year. We've talked about face masks and stuff like that. People have actually produced, we are exporting. In the beginning, we shut down, because of social distancing. A lot of workers went home. But in no time, people had spread themselves out. We had shut down because of exports to Europe, because there was a collapse in the market there. The statistics that have just been released today by the Export Promotion Council shows that in the last 5 months, we have exported, the last 9 months, we have exported more than we did last year. And it is because Kenyans rallied, bore these restrictions, but they were very, very determined to work. So in that sense, I think our response wasn't really surprising, because I think it is innate in Kenyans to respond to these to situations. We've got a very, very positive attitude, and we have taken this opportunity to construct ourselves. The way the government in Kenya responded, we talk about lockdown, but when you read about what other countries have done, we actually haven't had the lockdowns. We have had restrictions, but people have managed to work within those restrictions. We've had guidelines, and people have observed that guidelines. Thankfully, as Dr. Ambacho says, by observing the guidelines, you're not as sick anymore, but you're productive. And I think that for me is, answering that question, is that we have really taken this opportunity. The second thing we've used this opportunity is to rebuild back our confidence in our own industries. We've been talking Buy Kenya, Build Kenya, but we haven't taken all the necessary steps to actually do that. Thank you, Jane, for the committee for buying from Kenya. We have gazetted a list of products that can be procured from within, by government. And therefore, it is the challenge to Kenyan industrialists to ensure that this faith is not misplaced. There are many people who import medical goods. They showed up, they went to the press and said, these things are not, they don't meet standards. But the doctors themselves will tell you that the locally produced PPEs, they feel more confident in them. So we need to start believing in ourselves and rising up to this challenge, and we can confirm we can live with restrictions, but we can still be productive within them and discover new ways of working. You can have a meeting without drinking tea, but you'll still have the meeting from wherever you are. So we can, we can be very creative.
Okay, there are some people who say, or some experts, economic experts, who say that Kenya has relied more on import distribution and less on export production. Would you say that these are some of the lessons we are taking going forward, that Kenya does actually have the potential? It's just that it's taken us a crisis like the COVID pandemic for us to realize this potential that lies within the country?
No, I think to correct you, Kenya, I think the policy of import substitution died a long time ago. I think we recognized that we needed to have an open economy. So the question is, we've actually been building up on our exports, and that's been part and parcel. And the reason we have trade agreements and all these reach outs is to expand our exports. But there are critical commodities that we hadn't developed the capacity to do. And I think the whole world, it's not just us who've woken up. The disruption of global supply chains has made people realize that you need to have some critical supplies when you need them, and therefore you need some critical capacity for it. And that's what we will continue to do. But we are only about 50 million people. We cannot just produce for ourselves. So we must have the capacity to produce for the rest of the world. And as we now work on implementing our export strategy, it's critical to look at the goods that other parts of the world import from others and confirm if we have the capacity to produce. And my confirmation and the confirmation we've had for ourselves in these last 6 months is that we have that capacity, and we need to merge the energy of the private sector and the policies of government so that we can produce better.
Okay. Governor Anyang' Nyong'o, I would like to pose this question to you from the county's perspective. What have the counties been doing to support local economies? Because at the start of the pandemic and when the directives came into place, there was cessation of movement, and by so, most of the businesses that operate inter-county were affected. How have you been able to stimulate local economies at the county level and at the same time, still boost growth amid a pandemic?
Thank you very much. I think that's a very, very appropriate question. Counties have not only been stimulating local industries, manufacturers during the pandemic, but even before. We have been investing in labor-intensive programs in the counties. I'll give you an example, such as in Kisumu, we have what we call County Roads Maintenance Teams, which we use to maintain roads and build access roads, very much in the way that the Public Works Department did in Kenya some time ago. And we buy machinery from the local market, simple and complicated machinery, from wheelbarrows, lashes, tractors, so that these young people trained at the Kicc Roads College, can get employment, but also contribute to the building of the local economy. If you take county of Busia, for example, in a program that is supported by one of the donors, Busia County has been able to establish a cage fishing enterprise in which there is partnership between the local young people, the women, business communities, and capital from diaspora. Come up with a very good formula whereby one person does not own more than 10 cages, however much capital you have, and the young people who are working in this fish cage can not only get employment, but some money is also saved so that make sure that their families can send the kids to school. I think it's an example worth following in the other enterprises in other counties. And I'm quite sure that when we're going to be launching our economic recovery strategy for the county, we shall have time for sharing lessons, see how counties can still go ahead and stimulate domestic industrialization while also getting employment for our people. Second thing is to build institutions that can be able to stimulate local entrepreneurship. Again, I'll use my county, in Kisumu County, for example. We're just finishing the build of Business Innovation and Incubation Center, where we hope that again, young entrepreneurs can get the opportunity. When other overheads are paid for, the county government develop their entrepreneurship. And finally, let me say the following. As Betty has pointed out, I personally think, and this is my view as a scholar as well as a policymaker, that the policy of import substitution, industrialization, was thrown through the window maturely, mainly because of the pressure from the Washington consensus. And I don't think that given the kind of things that we need in the domestic economy, let me give you an example, sufurias.
Yeah.
How many people use sufurias in Kenya? Millions. We need to import sufuria from anywhere. We can make our own sufurias and use them. And from making sufurias, we can learn to make other things. And therefore, in substitution, industrialization, COVID time, was proved to have been given up prematurely. Governor Kuti just gave you examples of sanitizers and sweets and so on. Many more examples can be given. But I really think that even in counties, we have seen and we have learned that in many ways we need to produce certain things locally, especially when there's a shutdown and the airlines are not coming, buses are not coming, then you must be self-reliant on certain things.
Right.
Finally, in the area of agriculture, Madam, I think the smallholder production, the smallholder family, is still the heartbeat of this nation. During the pandemic, we learned that without food, you can't go anywhere. Our smallholder producers, so-called farmers in the rural areas, depend too much on the market for things they can produce at home. When I was growing up, for example, the only thing we bought in the market were three things: Ibiritis, sabunis, and salt. All the other food was available in my mother's compound. Beyond the kitchen was a little garden where all the vegetables were available.
Right.
In the courtyard was the cattle shed where the cattle produced milk and we could use it for both ghee and milk. Next door were the chicken, producing eggs and themselves for eating. So we find that within the household economy, there's a lot of self-sufficiency. We must learn in the post-COVID situation, in counties in particular, support this household economy by providing seeds, by teaching the farmers how to use their soil scientifically, because certain seeds cannot grow in certain soils. In other words, we should reintroduce what I call extension service, which apparently has been relaxed. This really is the nerve center of stimulating the household economy. Thank you.
All right, thanks a lot, Governor. Archbishop Anthony, I would like to come to you as well to pose this question to you. Archbishop Muheria, who is the chairperson, Interfaith Council on COVID-19. Some people last went to church, literally, when the directives were announced. And they've had to find other means to, seek spiritual nourishment. And this includes Zoom prayers, and also, going online to figure out how exactly, and just praying in their homes. But what would you make out of it? Because for now, it's been several months later. Do you think the congregation, the populations, are still close to God or to the spiritual higher power?
Thank you very much. First, let me thank the invitation to be on this panel, because I seem to be the only one who doesn't have $1 written on me or a Kenya shilling. But fundamentally on behalf of all religious leaders and the religious faith community, because it's a recognition of the power of hope. Because the faith communities are actually in the business of hope. And the power of hope in transformation, the power of hope driving through crisis, the power of hope to actually turn minds and even bring about all that what my colleagues on the panel have been presenting. This, at the beginning, was not so obvious. We perhaps focused very much on the health, protection, and other areas which are more directly medical or just economical. And we perhaps forgot that most intimate and perhaps more compelling part of the person, that is the spiritual and the psyche. And this is where perhaps the closing of the places of worship to public brought a big shake-up for an average Kenyan, because that is where you find solace, that is where you find hope, that is where you even find yourself, because this thing that comes upon you totally disorients you. And at the beginning, I think we missed it a little bit, but very soon, and as was directed with the formation of the Interfaith Council by His Excellency the President, and that has walked and steered the people towards a different kind of worship. It is a connectedness that bridges the social distance, that bridges the physical distance, and bridges the spiritual distance. And that has come through technology. Of course, most of us didn't know Zoom before COVID, and we discovered it. And from having a congregation of 300, you end up having a congregation of 3,000. From reaching out maybe before to only 100 hearts, you suddenly find yourself reaching out to the whole world. And this, I think, is a fantastic achievement, because that will not end now. It is about finding out how we can scale up this kind of connectedness. At the same time, I think that people have been a little more attentive, because the vulnerability of the human person has been exposed. Irrespective of your level of social status, irrespective of your financial status, and even technological advancement, we find ourselves all at equal ground when COVID came in. And so suddenly we find it is not enough to have an insurance of health or insurance of wealth. And suddenly God comes into the center of all this. And since our nation is very God-fearing and God-loving, I think this is also a wake-up call that all that we are doing in development must have God very much in the center. And that's why we thank even the religious leaders who have played a tremendous role in complementing government efforts, in reaching out to compliance, reaching out to follow up the guidelines we've received, and even to give hope. And I think if there is anything that COVID has been very strong on any sector, it is to awaken the power of hope. And that power of hope comes from a deep-seated faith.
Right.
So to answer the question you asked, yes, people are still perhaps at home, the elderly especially, but their faith, I think, is undented. They have discovered new ways, the ways of the radio for the upcountry and rural community, the ways of the TV for those who've got that access. But I also think even the ways of family worship and being together before God and feeling a new calling to play a very important point and role of solidarity in our nation. So yes, it has been a lesson, but I think it's a lesson that has made us grow and has made us even more godly, I believe.
Are we going to see more Zoom prayers and less people going to places of worship?
No, I think we'll see more people going to places of worship and more people participating in Zoom forms of worship. It will be not now going back. I do believe we're going to go forward. Right. In our going to all the counties with the Interfaith Council, which has done great, I think that is what we've received, an overwhelming response that people are hungry to be connected, but at the same time recognizing that times are changing and we are learning. Many religious leaders who didn't have any IT exposure suddenly have become IT experts with their iPads, with their Zoom cameras, and I think that is now a new space of reaching the God's care to the people. And beyond just the fact of religion, I think it is a point of hope, challenge, and that God cares for us, but we must now do more, even moved by the fact that God has protected us.
Great. I would now like to come to Jaswinder Bedi, who is the proprietor for Bedi Investments. Before the pandemic, you were not manufacturing masks or PPEs, and then came the pandemic and you had to reinvent, and now you are churning out possibly the highest number of PPEs in the country today. What informed this, and what lessons, what business lessons have you drawn out of this pandemic period?
Thank you very much. I think I must thank His Excellency the President. He called me early March, I still remember, and those words still come back to me repeatedly. And he said to me, Bedi, we need an in-country local solution. We don't have enough PPEs in Kenya. And I said, Your Excellency, we don't make PPEs, but let me think about it and let me see what I can do. And within no time, in 10 days, literally, I had a prototype ready. I went to the Minister's office, Minister Betty was sitting here with me, and I said, Minister, I have developed this prototype PPE, and I would like us to take it forward. In less than 2 minutes, she called Minister Kagwe, and she arranged my meeting in literally 2 hours. I was in the Ministry of Health, and Minister Kagwe called his entire team, all the doctors, everybody you could think of into a meeting, and said, guys, we have a local solution. And of course, from there on, the testing went on and things went on. And it was, for me, a learning experience that had it not been the challenge that Your Excellency you gave me personally, this wouldn't have happened. It actually encouraged many other factories, not only my own company. It encouraged more than 100 factories today who are doing this. And yes, we had to reform ourselves. It was a question of repurposing. It was a question of retooling, reinventing, re-engineering, refocus. So my biggest buzzword today is re. What else can we redo? I mean, what should we reinvent, or how can we be resilient, and the recovery, the redesign, the reimagine. So that's what this has taught Kenyans. And you know what? I was reading something the other day from Dr. Zeus, and he said when bad things happen, you have 3 choices. 1, you can either let it define you. 2, you can let it destroy you. 3, you can let it strengthen you. One thing I can say with any fear or contradiction is, as Kenyans, we chose, let it strengthen us. And as Kenyans, we are much stronger today than we were pre-COVID.
All right. We are much stronger, and there's more resilience, and that, I guess, is the spirit of what we've been seeing since the pandemic broke out. People have been doing unconventional things, but still being able to stimulate growth in the economy. Ambassador Yatani, I would like to come back to you. In terms of policies going forward, many Kenyans, if not all Kenyans, are expecting that growth will be facilitated through the different interventions, like the ones we have seen during the pandemic. They have been reliefs, both fiscal and monetary interventions. And a lot of people are now saying, is this going to go forward? And if not, what are some of the policies that will need to be reviewed to be able to stimulate the next fiscal year, for instance?
Yeah, thank you very much once again. And it's really important to realize that every problem provides opportunity as well as new coping mechanism. As a country, as an economy, we are still determined to rationalize government expenditure, but promote to a great extent private investment. And to this we are now trying to support, by all means, particularly the micro, small and medium enterprises, by coming up with a credit guarantee scheme, where the national government has already provided a seed capital of 10 billion, and as a result of engagement with the banks and other institutions, we already prepared the framework and will be rolling the next few weeks. This now will provide access to the SMEs, where they'll be engaging in the various fields, create jobs, create markets, create opportunities. Additionally, we'll also continue to invest on the Agenda 4 projects, because they are the life, the blood of this country. When you look at housing, when you look at jobs through manufacturing, when you look at the universal health coverage, when you look at food security, these are basic human requirements. We are going to invest heavily to ensure that they continue providing jobs and opportunities for the rest of the Kenya. We are also looking at policy reforms in the tax areas by seeing that, so that our policies and taxes will be more facilitative for a good business environment rather than punitive, or rather than just as a basis of collecting revenue. And to this extent, we are now reviewing part of taxes, like, the turnover tax. You remember, at the onset of this challenge, we are reduced from 3% to 1%. And we want to continue sustaining that. Because that's where most Kenyans are, and we want to be more facilitated. We also want to streamline tax administration by making sure that people who are supposed to pay, they pay without options. And ensuring that, there are no leakages. But to a great extent, we also want to grow the base. Rather than, just tax a few people, we want to grow the base by ensuring that most Kenyans who are within the tax bracket pay, because we cannot survive without those taxes. We cannot survive without revenue. We want better and enhanced service delivery. We want to achieve more development. Because I think I also need to mention this. At the time when we were hit by this challenge, we were actually at a turning point where we said we were going to work on a fiscal consolidation process by making sure that, we reduce our appetite for loans, particularly commercial loans, completely getting rid of commercial loans. And if you have to borrow, we borrow sustainably, we borrow from the concessional window. But, the magic about it is that you can only substitute with your own revenue. Casting the net wider and have, without necessarily compromising on growth. These are what we are looking at. And I want to say with satisfaction that today, the last 1 year, we have not borrowed commercially. Kenya has never defaulted on any loan. And by any index, we are among the most favorable, because if you look at, sometimes for you to achieve faster development, for you to achieve more development within a very short time, and also as a stimulator, like the infrastructure projects, they enhance trade, investment, and opportunities by creating more jobs. But how do we now achieve all this within a very short time? And the kind of resources available to us are not adequate. And all countries, all developed countries, have a basis of borrowing. Look at Japan. To the extent of 238% of the GDP, that's what their loan status is. And we are at 57. And many countries, and the US is about 110. So the countries that we depend on for support, they are also developed as a result of borrowing. So those, we are looking at many other measures by also rationalizing government expenses. There are certain expenses that does not add a lot of value.
Right.
If you look at foreign travels, the person has been traveling, uncoordinated and in whatever numbers. All this is now outflows of our foreign reserves to go and do investment and create jobs elsewhere. Instead, now we are looking at those critical sectors of growth on tourism, as well as also the recovery process. The private sectors are on board, and we know together we now look at those indices that if investment is done properly, is going to enhance the outcome of the desired process. But we are not also on our own. We operate within a region of the East African community. We also have to be alive to the policies and directions of the community.
Right.
Because you have that reciprocity in terms of what we need to do here, that has a direct bearing on the region. We do not want to really outcompete ourselves out of the market. We have to remain competitive. But, the journey ahead is quite, in my view, from where I sit, I'm very optimistic. Because we've managed to...
Second answer is that there's also a great opportunity in the external market. The Africa Continental Free Trade Area, for instance, we've done an analysis, and it shows that even with just basic foods, processed foods, there's a lot of opportunity because that is currently imported into the continent. So for our agro-processors, these beans that you pack and only send to Europe, you can actually pack and send to Cote d'Ivoire, you can pack and send to Congo. The fish, that we have here, with the chicken, for instance, people will tell you in Congo, they can't get good chicken. And here you are, we say we don't have a market for it. So there's a great opportunity for agro-processed within the continent. There's also a great opportunity outside.
Is the fact that they're not streamlined business regulatory frameworks to allow them to operate freely. And so this in itself is a challenge. How do we, going forward, make sure that these are streamlined to allow for better business conducted at the devolution level?
I think that is a work in progress, really. And I think together with the Ministry of Industry and other government departments, the Council of Governors is working very closely to make sure that rules, regulations, and procedures are streamlined. I'll give an example, the area of taxation. I think there's been a lot in the press about businessmen experiencing taxation across borders in counties. You have to have a license for this and the other. But I think this is a national problem, really. If you take, for example, the cost of production of any item in any industry, very much affected by energy. If you look at the bill you pay to Kenya Power and Lighting Company, those of us who use these tokens, you find that 30% of what you pay is taxes. And this is prohibitive. Now, the counties too would like to raise certain domestic revenue to finance their development. Many counties have established youth enterprise funds, women enterprise funds, and so on, so that to support local entrepreneurship. Now, I think it would be good if we had a meeting like this with the national government to rationalize some of these taxes and ways in which we can stimulate domestic production and entrepreneurship. And so I think that that concern is genuine. It's a concern the Council of Governors has also taken very seriously. Recently, when we undertook this of economic recovery in counties, I was amazed at the various projects and initiatives counties are taking to stimulate domestic industry. Data is not there that we knew, but this study has revealed us a lot of information and data. That means on the level of national government, we should invest heavily in research and in universities to give us information on what we are doing and what we ought to do. I think in the area of health, for example, you found that when the Ministry of Health wanted to know whether we could produce a local vaccine, they approached the right institution, Kenya Medical Research Institute.
Right.
And that approach itself showed you that the Ministry of Health did not know or was not quite aware what the KMD was doing in terms of doing research in such vaccines. And you remember a debate ensued whether the ministry had invested enough in Cambria and so on. But it's a reality in our country. I think the reliance on data for policy making is important. And COVID showed us that good data leads to good policy. And therefore, at the county and national level, we are really not going to do much if we don't have good regulations to stimulate research, get good data to make public policy. Following. I think we're a country of great potential, really. And this COVID-19 experience has shown that this potential is not fully exploited. I think in our countries, we have a great potential of having poles of industrialization. Remember, Thailand had this program, one product, one village. I think we can begin by having a policy, one industry, one county.
Yes.
To capitalize on the potential of counties. I'll give you a last example. For example, Baringo can produce a lot of honey. West Pokot too. Now, how are we capitalizing on that production of honey in these two counties? Secondly, in lots of counties in Central Province, avocado is now a going concern. Everybody is trying to produce avocado. And there's a lot of demand for avocado in the global market. Now, to what extent can avocado be produced in other counties? And what type of avocado? Have we done the soil chemistry in our counties to see what kind of agriculture can best give the highest results in agricultural production in these counties?
Now, that means that our previous investment in research institution in the area of agriculture, to what extent have we kept on putting money in that research to tell us what our potential is and where we can invest in agriculture for the highest productivity? I think this is what we learned from this COVID experience, that we have left a lot of our potential lying below the radar and not exploiting them properly.
Okay. All right. I would like to come to just with before I can give the last word to our Archbishop. What more support do you think the government can give to businesses across the country to allow them to thrive?
Thank you. I think the government, like the Minister said, were very quick in the way they reacted and very quick in the way they implemented policy. They brought the VAT down, they brought the income tax down. And one thing I must commend His Excellency, the President, is that the cash deposit ratio with all banks was 5.25%, and he moved it down to 4.25%, releasing 37 billion shillings for Wanjiku. Unfortunately, that money didn't make it to Wanjiku. That's another subject. But the truth of the matter is, government did a lot. Did private sector reciprocate? Yes, they did. Could we have done better? Yes, we could. What did we do wrong? Few things that I think funding is the single biggest challenge to most industry and most micro enterprises in Kenya today. And that funding, we must unlock funding.
Great.
If you saw the rest of the world, you saw Europe, US, they were throwing money at the problem. We were taking money off the table.
Okay.
Big paradigm shift needs to happen. And if we can fund Kenyan industry and Kenyan entrepreneurs, Kenya is going to fly high. I can guarantee you that.
A paradigm shift. Our Archbishop Anthony Muheria would like to give you the last word. Kenyans are, to an extent, depressed, understandably, because there's been loss of lives, there's been, teen pregnancies, gender-based violence, and all these things happening in our societies. But then the future is bright, we hope, and would like for you to speak to all Kenyans out there who are watching you and listening to you right now. What is your message to them?
Thank you very much. First and foremost, I think COVID has revealed the issue, as I said, of vulnerability and the need for us as humans to wrestle and to know how to accommodate and manage vulnerability, be it economic, be it be health, and be it be spiritual. And also here too, be it be also in the area of mental health. We have seen that it has revealed of family health. In other words, that our families are having bad health. We've had so many incidents of domestic violence. But I think this is going to challenge us going forward, that we must have a kind of a programmatic attention to the human person, not only about the well-being in terms of economic, but above all, the spiritual psyche and the environment that will manage them to reach that peaceful, harmonious living and also achieve their goals. We are in the mission of hope. And I think this is what would like, if you allow me to conclude all what we have discussed, is that COVID has taught us, if we keep a firm grasp of hope throughout, irrespective of the challenge and the threat, that hope will drive us humanly to do much greater than even what we had thought before. The second, that hope is not a line that is not connected. That hope is a connection to God. When we started the COVID struggle or the fight, our President, His Excellency Uhuru Kenyatta, invited us to pray to a national prayer day. That was a first sign across the globe of a country that thought that was very, very important. I think we as a country must not lose that perspective. And the hope is connected to God. And finally, that even the challenges, including the challenges, need skills. It is not enough to have goodwill. It is not enough to want or to hope things will change. We need to up the skills of mental health attention, the skills of business too, because I think we have to sharpen our business. But we also need the skill to learn how to meet crisis with strategy and challenge, as we have learned. So to all who are listening, and especially to our leadership here, I think they have given us a good lesson, the lesson to trust God, but also a lesson to keep our eyes on the ball. And that ball is the hope of the Kenyan people. And I think our hope is really up there, that we are emerging even more powerful than we entered this crisis. Thank you.
Thank you very much. And thank you to all my panelists, Ambassador Ukuri Yatani, the CS National Treasury and Planning, CS Betty Minor, who is Cabinet Secretary, Ministry of Industrialization, Trade and Development, Governor Anyang' Nyong'o of Kisumu County, Archbishop Anthony Muheria, the Chairperson, Interfaith Council on COVID-19, and Jeswin Desmond. Thank you all so much. And I would now like to invite Peter Wanjohi to come over. Thank you very much, ladies and gentlemen.
Na sote kwa pamoja tuungane tuimbe vifungu vitatu vya wimbo wa taifa wa Jamhuri ya Kenya na kifungu kimoja cha wimbo wa Jumuiya ya Afrika Mashariki.